It's Time Warner Cable's local edition. I'm Brad Pomerance, and we are joined by Clara Potes-Fellow. She is with the East Valley Community Health Center. Congratulations. You have just opened your third clinic, this one in Pomona. Two more are coming online. Let's talk about the new clinic in Pomona.
It is a really fantastic facility. We moved from a 10,000 square feet facility on Fairplex Avenue in Pomona to a 25,000 square feet facility. So we were able to expand the scope of our services to also include dentistry and mental health.
Your timing couldn't be better. We know that as a result of the Affordable Care Act, the number of individuals that are able to access primary care skyrocketing.
Absolutely.
Well, you can say a lot of things about the Affordable Care Act, but a lot of people signed up in California. A lot. I mean, over 1.5 million. And so they need physicians. And we know the Inland Empire, for example, that region has a dearth of doctors and nurses, but you're opening clinics for that purpose.
Absolutely. With this clinic, we increased employment in Pomona by 25 people, 25 professional positions. Right. Just by opening this clinic. We had a staff of 75 and now is 100.
How are you able to change the way people look at accessing medical care? If one had not been insured, they would access medical care through the emergency room. But now if they're covered through Covered California or through the Medicaid expansion, they can go to a clinic with much more ease. But that's a new way of thinking. How do you educate them on that?
Actually, they are ready. They just needed the ability to have access to services. They knew that they were underserved and they were looking just for the opportunity. So it's not too difficult to convince them to come. I think that they are very pleasantly surprised to see the quality of services that they get at a health center like the ones we operate. They have, excellent primary care physicians. They get the same doctor for the life of their services at the institution. And they just go to the same individual. They get a team of doctors. Every patient is assessed not only for primary care, but also goes to the dentist and to mental health assessment. So we see the individual as a holistic patient that requires to be seen, assessed, and helped entirely as a human being.
When the Affordable Care Act started to roll out in October, especially in California, there was a desire to increase those that are insured that are of Latino descent. In the early months, Latinos were not enrolling in Covered California. They were not accessing the Medicaid expansion. But as we got closer to that March 31st deadline, Latino numbers really started to pick up. And while they still are lower than had hoped for, they're much better than they were early on. What went right at the end?
I think community education and also the training of the facilitators. We have 12 facilitators that are doing community outreach at the malls, at different shopping centers, strip malls, and schools, and they just have to have some knowledge of the system in order to be able to counsel people. Also, it's not a simple thing to do.
Oh no.
It takes usually 2 appointments. One where you give the person orientation in terms of what the Affordable Care Act is, what the exchange is, and show them the possibilities,
right,
and see the different prices because it varies
and
according.
Then they come back.
And then they come back and they sign up.
I want to thank you so much for joining us. She is Clara Potes-Fellow with the East Valley Community Health Clinic. My name is Brad Pomerance, and this is Time Warner Cable's local edition.